Bismillahirrahmanirrahim. Assalamu alaikum. This is Dr. Ghufran Babar, and you're watching my YouTube channel. Today's topic of hygiene pediatrics is on acne. Before we go on and learn about this topic, please share and like this video and subscribe to my channel. Thank you. So acne is a very common disorder in young teenagers, young adults, and maybe throughout lives in some people. What is acne? So we have special glands on the face, chest, and the back, particularly in these areas, which are called sebaceous glands. And the utility is that they make secretions, the oil-like sebum that keeps the skin moist and healthy. And things can go wrong under the effect of male hormone, the androgen hormone. The androgens include at a young age coming from the adrenal glands, the DHEAS, androstenedione, testosterone, and activated form of testosterone which acts on these follicles is the free testosterone. So this can happen either during the puberty years or in those people who have more male hormones in their blood. So these glands, they are located on the skin of face, chest, and back. So they keep on making the sebum, and they keep on shedding cells inside these glands as well. Sometimes this shedding blocks the opening of these glands. So the secretions are kind of trapped inside the gland itself. So they may form non-inflammatory, in which there is no inflammation, kind of blackheads or whiteheads, which may appear on the face, and people try to take those blackheads out, and that kind of takes care of the problem by facial, by using face washes. So people use different techniques. The second aspect is more severe one. So if these secretions are blocked inside the gland and bacteria grow in them, and the bacteria that grow in them are Propionibacterium acnes. So acne is an inflammation. So they may start as small papules like a swelling on the skin, or they may form pustules like pus containing things that may point, and you have seen people having those pimples with pus pointing at them. They may form nodules if the inflammation goes deeper. They may form cysts as well. A big cyst can form, and ultimately these things can lead to healing, and the healing is followed by disfigurement and scarring. So the problem with the disfigurement and scarring is, even before that, the pimples or the blackheads or the inflammatory acne, and the final result, the disfigurement and scarring, can lead to depression. And people are very sensitive about their looks. So girls and boys, especially the girls, they are very particular about their skin health, and especially the skin of the face. So that can lead to depression and lack of adjustment. People don't want to go to the social gatherings, and that is kind of a snowball effect which people suffer at the hands of acne. So how to keep your skin healthy and to prevent acne? One thing is the simple things. You keep your face washed. Wash it with the soap and water every day, 2 to 3 times a day. And if you're offering prayers, you're doing wudu, and you're cleaning your face anyways. Simple face washes with benzoyl peroxide, sulfur containing face washes, vitamin E containing face washes, which is an antioxidant, keeps the skin smooth and moist. People do facials that gets rid of the dead skin and brings out the fresh, healthy skin. So that is another way of keeping the skin healthy. The problem starts when it goes into an inflammatory phase. So the blackheads, whiteheads, which are because of the retained and hardened secretions of the sebaceous glands, can be taken out. But if there is inflammation, then the process is kind of a tricky one. The inflammation is because of the Propionibacterium acnes. So it's a bacterial inflammation, has to be treated with an antibiotic. And people are given 7 to 10 day courses to treat the acute inflammation. Different types of antibiotics are used. Tetracycline, like monocyclines, are used, given for 100 milligrams once, twice daily for 10 days. However, sometimes long-term antibiotics are needed on a daily basis to prevent the recurrence of inflammation. As they say, keep your hands to yourself. So do not touch the inflammatory acne lesions, because if you will touch it somewhere else, the inflammation will spread to other places. So antibiotics is another important thing which is needed for the treatment of acne. Vitamin A based acne creams are also isotretinoin, can be given as well. Clindamycin and benzoyl peroxide combination is also very famous to treat the topical, just on the skin, the cream. A combination of clindamycin and benzoyl peroxide can be used for the topical treatment. Ultimately, if it becomes nodular and cystic acne, then Accutane, which is isotretinoin, can be given in the pill form. And make sure you screen the kids for depression, because sometimes it can cause depression as well. And it has to be continued. It is a very, very, very good treatment, anti-inflammatory effect of this vitamin A and chemical, which will treat the nodular and cystic acne to prevent the disfigurement and the scarring. And while the child or teenager or adult is on treatment, then they may need to be on the oral contraceptive, because if they're sexually active, of course, because it can cross the placenta to cause the teratogenic or bad effects on the developing fetus. Those women who are of childbearing age and have irregular menstrual cycles, there is a syndrome which is called polycystic ovarian syndrome, or PCOS. If you have two of these features, which include androgenic effects or male hormone effects, because their free testosterone or the active testosterone level is elevated, or the male hormones are elevated, they may have acne, thinning of hair, excessive infection in the underarm area, male distribution of facial hairs like hair on the upper lip, chin, sideburn area. That is one of the features. Then irregular and or heavy cycles, and we call them anovulatory, because these women are not able to get pregnant or conceive the children. So that's the conceive the child. So this is the second feature. Third feature is when they do ultrasound, cysts could be seen on the ovaries. So this is a combination of events or combination of symptoms and signs called polycystic ovarian syndrome. The first line of treatment in these women is using the oral contraceptive. And all oral contraceptives can be used on a regular basis until the things resolve. And this will result in regularization of menstrual cycle, removal of the androgenic effects, and the treatment of the acne. Other things are to block the effect of male hormones are spironolactone, which also can help in preventing the conversion of testosterone to dihydrotestosterone, which is the active agent working on the skin causing the acne and male distribution of body hair. So spironolactone is another medicine, can be started on 25, 50, and the dose can go up to 100 milligrams. And then remember, it is a potassium sparing diuretic. So serum electrolytes should be checked in these people to make sure that they don't have hyperkalemia or elevated potassium levels in the blood. And again, the people who are on spironolactone should also be told to take an oral contraceptive or sexual abstinence, or should not be sexually active. Another medication is anti-androgen, the flutamide, which blocks the androgen receptor where the androgens work. So that has also been used in severe hirsutism or male distribution of facial hair, severe acne, that can be utilized as well. Liver functions have to be monitored because the medicine is metabolized in the liver. So in summary, a healthier skin on the face and rest of the body gives us a healthier outlook in life. It boosts our confidence and makes us happy. To do that, make sure you wash your skin regularly with soap and water. Face wash like benzoyl peroxide at bedtime helps, since it can bleach the clothes, so you have to be careful. Available over the counter. Then the specialized treatments, facials can be performed. And then if it is inflammatory, you need antibiotics, vitamin A topical creams, retinoid creams with benzoyl peroxide, with clindamycin or erythromycin can be used. And if it is nodular or cystic, Accutane or systemic isotretinoin in the form of a pill or a tablet can be taken. If there is a component of polycystic ovarian syndrome, oral contraceptives have to be given. Anti-androgens like spironolactone and flutamide can be tried. Hopefully this lecture was useful in understanding the acne and the management of the acne, which is a very, very, very stress-causing event and illness in young adults, in females, in males, because a healthier skin will keep our mind and body healthy. Please like this video, share this with your friends and family, and please subscribe to my channel. May Allah bless all of us. Sallallahu alayhi wa alihi wa sahbihi wa sallam. Thank you.